I'm Dr. Katie O'Neill. I'm an associate professor of clinical medicine with LSU, and I'm the chief medical officer at Our Lady of the Lake here in Baton Rouge. 2 weeks ago, we stood here, just over 2 weeks ago, with 36 COVID-19 patients in the hospital. Today we have 155, which is our max from last April in 2020. It doesn't sound like a lot, honestly, when you think about numbers. But we are the largest hospital in the state. We have almost 800 beds. We have 713 people admitted today. And no one diagnosis should take up 1/4 of your hospital. It doesn't happen. It's not imaginable, except for now. And we can't tolerate it because it's putting an incredible pressure on the rest of our patients and our hospital staff. When I left the hospital earlier, there were 23 patients on the board waiting for a transfer into our hospital for an ICU bed. Those are the ones that I looked at first. There's no reason to even look at the med-surg beds. They're never going to get here. But you look at every single one of those ICU beds and you spend all day trying to figure out how you can staff another one. Those are 23 people sitting in an ER somewhere. Many of those ERs are not attached to a hospital at all. There is only an ER physician. Many of those ERs are attached to a hospital that does not have a critical care doctor or a subspecialty cardiologist or a subspecialty surgeon. You have people with chest pain sitting in an ER right now where their families sit in the waiting room and they are wringing their hands and they're calling everybody they know. Do you know somebody who works at the lake? Can they get me in? Do you know somebody who works at Oxnard? Can they get me in? And they will do that for days. And that patient will lose muscle. They will lose years of their life, but they will stay in that ER because there are no more beds left. Those 23 patients are a glimpse of what we have been doing for the last 2 weeks while we have been trying to get everybody vaccinated. And it's not helping enough because it's not happening fast enough. And when you come inside our walls, it is quite obvious to you that these are the darkest days of this pandemic. We are no longer giving adequate care to patients. That has also stopped. And you heard from each of these physicians that we no longer think we're giving adequate care to anybody because these are the darkest days of the pandemic. How do I get those patients to this hospital? How do I open beds? Vaccination is going to get us there, but it will not get us there fast enough, and we will lose our friends and our colleagues because of it. But if we put on our masks, as we've done through the last several surges, we will see a decrease in hospitalizations again, and that will give us time for the vaccinated to work. Those who got vaccinated in the last 2 weeks already have protection, and I doubt that I will ever see them in our hospital due to COVID-19. And if you get vaccinated today and you mask up, I doubt that I'll ever see you. Yesterday I drove down 190, which is one of my favorite drives. And we got to see some rice being cut, which my father's a farmer, so that is one of my favorite scenes. We drove behind some people who were driving motorcycles, and it was the end of the day, so it was tolerable. We drove past some kids who were on their four-wheelers. Looked like they were having a great time. Usually that is an incredibly enjoyable drive, and all I could think about was that I have seen people in four-wheeler accidents and motorcycle accidents and farming accidents in the last 2 weeks who sat in their ERs in their small towns. Those are my people. Those are your family members. And when they get maimed today, they're not coming to a trauma center because there are no more beds. We have 67 empty beds in our hospital because we can't find any staff. We have a federal unit on the ground who usually I meet at the PMAC during a hurricane, but now they're inside our hospital and we can't even open beds with them because so many of our staff are out with COVID-19. We are out of things in our pocket to open beds. We need you to open our beds for us. Please do that by getting vaccinated today, which will help us open beds in the next several weeks, and by putting your mask on today, which will help us open beds soon. How soon? I don't know. We've never used a combination of masking and vaccination. We've always had to shut down other things, and we're not going to do that this time. We're going to ask you to vaccinate and to mask instead. But if we all do it right now, our numbers will be better, our beds will open, and we will gladly take the baton back from you and start to work on opening our beds ourselves. But right now we need you to do that for us. We're asking everybody in every single parish, all over Louisiana today to put your mask on and to go get a vaccine. Thank you.